birth?
My name is Molly, and my birthday is 1/12 of 86.
Okay, great. I'm just going to go ahead and check your wristband here, and that looks correct. And no drug allergies, is that correct?
That's correct.
Okay, super. And you, do you know why you're here in the hospital today?
I'm having a physical today.
Okay, great. Sounds good. And you know what year it is and day of the week?
Yep, it is Thursday, and it's 2014.
Okay, great. Before we start, it just should be noted that patient appears stated age. Her mood and affect are congruent. She's dressed appropriately for the weather, and there are no obvious physical deformities present currently. Okay, well, as we get started here with your head to toe, we're just going to be looking, I'm going to be assessing your skin as we kind of go, assessing for skin turgor, color, warmth, and then also any lesions, bumps, or tenderness on your skin as well. Okay? All right, and then also let me know if there's any pain, if you have any pain or tenderness anywhere in your body as well. Okay? Okay. So first we're just going to start with an eye test. It's called the Snellen test here. Basically, I'm just going to have you hold this 14 inches from your face. I'm going to have you cover one eye, and then I'm going to have you read the smallest print that you can with that eye that is uncovered.
Okay, 937826.
Okay, great. And go ahead and cover the other eye, and then read with that.
937826.
Okay, great. So your vision's actually better than 20/20, so that's good. That's very normal and appropriate. Okay, so we're going to go ahead and start with your scalp here. I'm going to be looking at your head, and then noting, like I said, any areas of tenderness or anything. I'm just going to go ahead and feel your scalp here. Okay. Everything looks normal. Your scalp looks healthy. I'm not noting any areas of tenderness. Good. And then can you go ahead and smile for me? I'm just going to check facial symmetry. Good. And then go ahead and shrug your eyebrows up. Great. And let me go ahead and palpate your sinuses here. Any pain or pressure in your sinuses?
No.
Okay, great. And then I'm just going to go ahead and do some kind of range of motion exercises with your neck here. Can you go ahead and move your neck side to side? Okay, great. And then go ahead and move your neck forward. And then up. Okay, great. We're just going to go ahead and move down and forward to your eyes here. I'm going to go ahead and have you cover up one eye again. And I'm going to go ahead let me know when you see the pen come into your peripheral vision.
Now.
Good. And then cover up the other eye.
Now.
Okay, good. And then I'm just going to go ahead and have you follow the pen with your eye, so just looking straight forward. Okay. Okay, good. And then let's go ahead and do the other eye. Okay, good. And I'm just going to go ahead and check your pupil here. Okay, great. And then I'm just going to go ahead and do some examination of your eyes here. Everything looks clear. The conjunctiva is clear. Sclera is clear. Irises are brown and normal. And then this is on a methoscope. Going to look at your eyes, noting any redness or areas for concern with that. Are you wearing any contact lenses right now? Okay. Go ahead and note those as well. Okay. Okay, that looks good. And your eyes look healthy. I'm going to go ahead and palpate the temporal artery here. Okay, temporal artery pulsations are present on both sides. I'm going to go ahead and just have you check your TMJ, your temporomandibular joint here. Can you go ahead and open your jaw for me? Okay, good. Close, and then kind of move it side to side. Okay, great. And then I'm also going to palpate your neck here for any tenderness in your neck. No, they're not palpable there, which is good. Okay, we're just going to go ahead and move on to your ears here. The outside of your external ears looks normal on that side. Normal on that side as well. No areas of tenderness while I'm feeling here. Okay, good. So I'm just going to do a couple of tests here with your hearing before we move on. Okay. I'm just going to have you go ahead and turn to the side there. I'm going to whisper, I'm going to have you cover this ear. I'm going to whisper something, and then if you could let me know what you hear when I say it.
Okay. ABC.
Okay. And then try to cover the other ear?
1, 2, 3.
Correct. And then we're going to go ahead and do some other hearing tests. We're going to do the Weber test first. If you could go ahead and let me know whether or not you can hear the sound on both sides of the ears, and then also tell me when the vibration stops, please.
Okay. Okay. It's equal on both.
Okay, great. And then the Riney test, I'm just going to go ahead and put the tool on the mastoid process here of your jaw, and then when you stop hearing that vibration, or please let me know.
Okay. Now?
Okay. I'm going to go ahead and do it on the other side.
Now?
Okay, great. So your hearing tests are both normal, which is good. And then we're going to go ahead and move on to your nose. Just going to go ahead and switch out my instrument here. And as I note your neck here, your trachea is midline. Your nose is symmetrical and equal on both sides.
Okay.
Any pain or tenderness on the outside of the nose here at all?
No.
Okay, good. So I'm just going to go ahead and turn my scope on and look up your nose here. Mucous membranes are moist, clear, and normal. No exudate. And that other nostril is clear and normal as well. Okay, great. So I'm going to switch out my cap here. And then I'm going to take a look inside your ears as well. Okay, great. Okay, great. That looks clear. I'm not noting any exudate in your ears as well, or anything to be concerned about on that end as well. Okay. I'm going to go ahead and have you shrug your shoulders up. We're just going to test some strength there. Okay, that's great. And looks like your head is normal, and ears, eyes, and is normal. So we're going to move on to your mouth and throat. Okay. I'm just going to have you go ahead and say ah. Okay, great. Tonsils are +2. Teeth are healthy. Mucous membranes are moist, and you can go ahead and shut your mouth. Go ahead and put that away. And I will go ahead and move on to doing some lung sounds in the back then here.
Okay.
We will go ahead and inspect the back as well. Symmetry of the back is present. There are no lumps, tenderness, cause for concern at this time. I'm going to go ahead and listen for some lung sounds. I'd just like you to take some deep breaths in and out. Okay, great. I'm going to go ahead and check for a tactile chromatis. I'm just going to have you say 99 as I move down your chest, or as I move down your back here. So just take some deep breaths in and out and say 99.
99. 99. 99.
Okay, great. And then I'm just going to go ahead and do some palpation here on your spinous process is normal here. It looks like your spine is in alignment. It is erect and normal. Going to go ahead and do some palpations in all of your lung fields here. Some percussion in all of your lung fields here. Okay. There's dullness in all lung fields, which is normal. And it looks like your breathing in the back here is unlabored, and symmetry is normal here. Okay. So I'm just going to go ahead and measure for some diaphragmatic excursion.
Okay.
So what I need you to do is just take a deep breath in and hold it. And I'm just going to measure here. And then go ahead and breathe out. And then I'm just going to go ahead and have you breathe in, hold it shortly, and then breathe out. Okay, I'm going to go ahead and measure that. And that looks like it was about 3.5 centimeters, which is normal. Okay. Okay. All right. So it looks like everything is okay in the back there. We're going to move on to the front.
Okay.
I'm just going to go ahead and inspect the chest here for some lymph nodes under your clavicle here, and then also if you could raise your arms up, we're going to look underneath your armpits. Okay, everything looks normal there as well. I'm just going to go ahead and listen for some heart sounds. First, I'm going to listen for the, actually before I do that, I'm going to palpate the carotid artery. I'm going to go ahead and find it here first. And then I'm going to go ahead and do one side at a time. Great. And then actually while I'm here, I almost forgot to check your thyroid. So we're going to go ahead and do that as well. Okay. I'm just going to locate the thyroid here. And then if you could go ahead and swallow for me. Okay, great. The thyroid is not full, which is normal. Okay, I'm going to go ahead and listen to your heart. So I'm going to listen with the bigger side of the stethoscope first, and then turn around and listen to the bell.
Okay.
And then I'm also going to take an apical pulse. So, and then while I'm here, I'm also going to listen to that carotid artery.
Okay.
That we were talking about before. Okay, good. Noting a heart rate and pulse of about 86, which is normal. Heart rate was strong and normal as well. And then while we're here, I'm just going to go ahead and listen for a heart murmur. I'm just going to have you lean forward just a little bit. Okay? Listen for that. And I'm not noting any heart murmur, so that's normal. I'm just going to go ahead and listen to some lung sounds on the front too while we're here. Okay? Go ahead and breathe in and out normally. Good. Great. And then while we're here, I'm going to percuss one point in the front here as well. Okay, that's normal as well. Okay, so your heart sounds good. It sounds strong. And then we're going to go ahead and I'm going to have you lie down, and we're going to check for some stomach and then also some stuff in your groin area.
Okay.
Oh, As we lay down here, I just wanted to, to have you lay down, I wanted to kind of instruct you. Has anybody talked with you about how to do a self-breast exam before?
No, not yet.
Okay. So usually you do a self-breast exam between the 5th and 7th day of your period, or around the same time every month, so that you can have an accurate reading from month to month. If you do note any lumps, tenderness, areas cause for concern, you definitely want to call your doctor or come back to the clinic and we can check those out.
Okay.
But basically you're going to use kind of your middle 3 fingers here, and you can either use a concentric circle method or you can use what's called a pie cut method. And basically the concentric circle, you would use all 3 forefingers and go out the breast in concentric circles.
Okay.
If you use the pie method, you would just kind of section out the breast in a pie and then move up and down as you feel for tenderness and lumps. Okay?
Okay.
So like I said, if you can do that every month, you certainly, it's a good way to prevent cancer.
Okay.
Okay? Okay, I'll have you go ahead and lie back and we can assess your stomach here. So, as I note, everything on your stomach is normal, symmetry is normal, color and no areas of obvious tenderness, lumps, or anything like that. Umbilicus is midline and normal. I'm going to go kind of assess for vowel sounds. Vowel sounds are present in all 4 quadrants, and while we're here, I'm also going to auscultate the for aortic brutus as well. Okay, go ahead and palpate those palpitations as well. And now I'm going to go ahead and palpate, and first I'm going to palpate for tenderness, and then as I move down, I'm going to do palpate for organs, and then also liver height as well. Okay? So I'm just going to go ahead and do some shallow palpation here. Please let me know if you have any areas of tenderness or pain. Okay? Okay. So I didn't know any areas of tenderness. There's no concerns about that. So now we're going to do some deeper palpation. So we're going to go ahead and palpate for first we're going to do the kidneys here. Okay. And then we're going to go ahead and do the spleen and then the liver as well. Okay. So all of those organs were normal. They were not palpable, which is good. And now I'm going to go ahead and percuss in all 4 quadrants, and then I'm also going to percuss for liver height.
Okay.
Okay? So, okay. And then I'm going to go ahead and, like I said, I'm going to percuss for liver height here. I'm just going to go ahead and get my pen. Okay. Go ahead and measure that out. Okay. The liver was about 6 centimeters, which is normal. Okay. And then while we're down here, I'm just going to check the femoral pulses here, which is in the groin area. Great. And then I'm going to go ahead and feel horizontally for the lymph nodes down here, and then also vertically. So horizontally and then vertically. And I'm not noting any tenderness or anything on those as well. Okay. I'll go ahead and have you sit up. And we're going to assess your upper extremities and then your lower extremities as well.
Okay.
Okay. And then do some neurological tests as well. Okay. I'm just going to go ahead and have you hold your arms out here. Looks like your color on your skin is normal, temperature is normal. To the touch here, not noting areas of tenderness or lesions as well. Capillary refill is within 1 second, which is normal. Any numbness or tingling in your hands here?
No.
Okay, great. Can you go ahead and squeeze my hands there? Great. Fingers look normal, no evidence of clubbing or anything. Okay, go ahead and put your arms down there. I'm just going to go ahead and listen for a brachial pulse here on both sides. Which is present, and then if you could go ahead and flip your wrist over, listen for a radial pulse. Okay, great. Okay, we're going to go ahead and do some kind of range of motion exercises with you, if that's okay. I'm just going to go ahead and have you kind of hold your hands out, and you can spread your fingers, and can you move on apart? Okay, great. And then have each finger touch. Okay, great. And then go ahead and bring your arms towards you, great. And then bring them back down. And if you can go move your hands rapidly, okay, super. And then you can bring your hands towards you, and then like I said, out again, and then to the side. And then I'll go ahead and have you raise your arms laterally, there you go. And then can you circumduct your shoulder as well? Okay, great. Perfect. And then can you do that on the other side? Okay, great. So it looks like you have good range of motion. And then I'm going to have you go ahead and hold your hands out there, and then don't let me put your fingers together. There you go. Great. And then I'm going to go ahead and have you push up on my hands. Great. And then pull down. Great. And then can you bring your arms towards you, fist? Okay. There you go. And then I'm going to pull, don't let me, and then push against me. Okay, great. And then same thing for your shoulders. Try to raise them out. Okay, super. So you have good strength, good range of motion in your arms. Okay. We're going to go ahead and do a few tests with your, in terms of some neurological tests here. And I also have one more area to test with your nose that I almost forgot about. So I'll do that as well while we're here. Okay. And then, like I said, we'll kind of move on to those lower extremities. I have something here that I'm going to have you close your eyes and smell for me. And then just have you occlude one nostril, so put one over it. Okay, and then just tell me what you smell here.
Coffee.
Okay, great. And if you could do the same with the other nostril.
Coffee.
Okay, great. And then I also almost have you just occlude each nostril, so you could blow through it. Good. And then the other side. Super, great. So your nose is great there. Almost forgot about that one. Okay, so I'm just gonna, the first test here, I'm just gonna have you close your eyes, and then I'm just gonna do kind of a series of touches on your upper and lower extremities, and just let me know when you feel it.
Okay.
Okay?
No. 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 No.
Okay, great. So that was normal. And then I'm just gonna, that was the sharp touch, and then our responses to pain. And then now I'm gonna have you do a soft touch. So same thing. You just let me know how that.
No. 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 No.
Okay, great. So you passed that one as well. And then I'm just going to go ahead and, this is the vibration test of the same thing, okay?
No. 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 No.
Okay, great. You passed all those neurological tests, which is great. And then I'm just going to go ahead and do some of those similar tests with your lower extremities, and then I think we can wrap things up.
Okay.
Okay. Any areas of pain in your lower extremities that you're having? Any cause for concern? Okay. Could I just have you remove your socks, and we'll go ahead and... Okay, great. I'm just going to note your toes here. Toes are symmetrical. I'm just going to look in between your toes here. I don't see any cause for concern. The skin on your legs looks normal. Color and temperature is also normal as well. I don't see any evidence of edema. Capillary refill is +2, which is great. That's well within normal limits. And no numbing or tingliness in your lower extremities? Okay, great. So I'm just going to go ahead and feel for a And then can you kind of bring your hip out? Great. And then have you go ahead and lift your feet off the floor and then plant your toes. Great. And then I'm just going to go ahead and do kind of those same things that we did with your arms. So you just kind of push forward and then push together. Great. And then have your knee up, resist. Great. And then same things with your toes. Okay, super. And then okay, great. So all of that's normal. I don't see any cause for concern on your lower extremities as well. Okay. Okay. Like I said, we just have a few more things to do here. I'm just going to have you stand up and do a couple more tests here. If I could just go ahead and have you stand with your feet together and then kind of fold your arms out and then close your eyes. And there's no evidence of swaying or anything like that. So that's a negative groundwork step. Okay, that's good. And then I'm just going to have you do a shallow knee bend. Great. And then I'm just going to have you bend forward a little bit so I can check your spinal alignment. Spinal alignment looks great. And you have good range of motion in your spine. All right. The final thing I'm going to have you do here is just go ahead and walk forward until we get to the end of the carpet and then turn around normally. Great. And then if I can have you walk heel to toe back. Great. Okay. And then if I can have you walk on your toes back to the edge of the carpet again. Great. And then if I can just have you walk in your heels. All right, super. I don't think there's any other things that I need to test from you today. If you have any other questions or concerns, anything, oh, I'm sorry, I almost forgot about your reflexes. So we'll go ahead and do that as well. Okay. I'll just go ahead and have you sit down. I'm sorry about that. I just have to do one more thing here. I'm just going to go ahead and check the brachial reflex, or the bicep reflex here. And then we'll go ahead and do the wrist here. Okay. Okay. And then we'll go ahead and just have you put your arm out like this and just check it out. Okay. Okay, great. And then I'm just going to go ahead and check the knee.